You're watching the station that works for you. Now, ABC 2 News at 6.
All right, hospitals here in Baltimore say now that they are as prepared as they should be if a mass casualty event would ever happen here.
But it would still take resources from around the city to deal with the hundreds of victims. ABC 2 News' Skylar Henry is live in front of MedStar Good Samaritan Hospital with doctors' reaction to this horrible morning shooting. Skylar?
Yeah, Kelly, you know, aside from watching the horror out in Las Vegas like the rest of us, the doctors and nurses here at the MedStar Good Samaritan Hospital say that they put themselves in the shoes of first responders, saying that they are thinking of the teamwork and the logistical support that it takes to put all this together so more lives aren't lost. As emergency personnel raced to victims' sides this morning in Las Vegas, here in Baltimore, Eddie Johnson watched, thinking of his training.
Would it be a pretty picture? No, it never is. However, I think we do just fine.
Johnson is in charge of MedStar's Safety and Emergency Preparedness Division. He says the devastation of dealing with hundreds of casualties, while overwhelming, would be manageable, but not without support.
We're as ready as you can be, because obviously 400 people, that takes a lot of resources. With all hopes that 400 people, what's supposed to happen is when an incident like that occurs, casualties are spread throughout the system.
A system that involved MedStar's largest hospitals and all of those in the health system, including the doctors at MedStar's Good Samaritan Hospital, like Dr. Bernard Ravitz.
If we had to be, we would. It's a matter of opening up a box, which we have, where we can tag casualties as they show up at the triage area. We have practiced multiple triage areas, so we usually have one, but if we had 400 people showing up at our doorstep, we would have to set up maybe 2 or 3.
Just one of what would be many triage stations throughout the city. A complex web of communications that's Johnson's job to weave through.
Emergency preparedness is accepted throughout the system. It's all the way up to corporate. We have our corporate command center. Everyone participates.
An elaborate yet necessary plan that saved lives, hundreds of them. Reiterating Johnson's point, the network of support from all of the 4 hospitals in the Baltimore City area that MedStar has, and actually all of the hospitals and medical facilities that MedStar has in their health system, would be crucial in an event like this one. For now, reporting live here in Northeast Baltimore, I'm Skylar Henry, ABC 2 News.
All right, Skylar, and our governor says Maryland stands in unity with Las Vegas. He wrote a message on Facebook about this mass shooting. It reads in part, "We send our deepest sympathies to everyone who lost loved ones and will continue to pray for all those injured and fighting to recover."